Brisbane is at 39%.
And rescue workers in Venezuela are continuing to search for survivors as the death toll passes 1,400. Thousands of people are still missing, so the toll is likely to rise further. Residents say there is a scarcity of government help, with families searching for loved ones among the rubble themselves. The acting Venezuelan president says her government is trying to mount a full response.
Well, let's get more on that situation in Venezuela. Catalina Vargas Villamarin is the country director for CARE Colombia. She joins us now from Bogota, where CARE is coordinating its response to the earthquake. Catalina, thank you very much for speaking to us this morning. What's the latest on the ground? What are you hearing about the humanitarian situation?
Good morning, and thank you so much for having me here to talking about what has been the massive disaster. I will say this earthquake didn't just cause a new crisis, and it's a collapse on the top of one. As you may know, this is devastating, and we as CARE, we are working in the field through partners. Local grassroots organization lead for women, and we are hearing about the multiple kind of needs. I will say, first of all, relate to protections, because everyone have lost their homes, and the shelters are improvised ones. Some of them set up by communities, settled in schools or public parks, and there are no minimum requirements, no sanitation facilities, no formal protection protocol. So this is for sure creates, on top of the damage, risk of gender-based violence and risk of high exposure for children and women. For sure, minimum needs are related to the wash, sanitation facilities, and food, because they are still looking for their relatives in the areas damaged by the earthquakes. So we are increasing the message about how to ensure international support for this increasing crisis in Venezuela.
Catalina, how challenging is it to get aid into Venezuela and the right amount of help?
Definitely. I mean, given the scale of this crisis, the primary challenge, I can say, is that it exceeds the local response capacities, because it's placing a lot of pressure on local actors. As you may know, this crisis is unfolding in Venezuela, which was already in the minds of humanitarian crisis, adding an operational complexity because of the inflation and the limited capacity to the volume of supplies and goods needed to support. So CARE's teams and local partners are actively reviewing which routes of mechanism are the most viable to getting assistance to people quickly. So the scale of this response is genuinely encouraging, but definitely it's important to mobilize international humanitarian assistance because the current response is under significant pressure from budget reductions. Just to give you a figure, the latest humanitarian response plan before the earthquake was only funded in at 23%. So it's important to have and calling donors to provide additional and flexible and emerging funding without cutting existing programs already that are supporting millions of people depending on.
Yeah, what sort of resources do they need to help people on the ground there?
I mean, I will say, for instance, dignity kits, ensuring non-food items because they don't have shelters, and dignity kits with sanitation items. It's important to ensure, for example, women that have lost her home and everything they have access to menstrual kits because this is a matter also of dignity and health. I will say also supporting children and accompanying children because partners are also reporting a significant number of unaccompanied and separate children. So children who has lost contact with their families are in the middle of the chaos. So this is an acute protection emergency, and this will require psychosocial support also for the people that have lost everything, but also protection mechanisms to ensure children are supported in a safe places. Also, women that have been victim of sexual violence, because this has been reporting also from our partners, because protection mechanisms are not in place for sure. So they need urgent protection support in place.
Catalina, what's the next steps in the humanitarian mission and also the rescue effort there?
Definitely. So the immediate term, we are scaling up distribution or hygiene kits and expanding gender-based violence case management to ensure the referral pathways, deploying crisis psychology support, and our partner named Tinta Violeta is doing an excellent work in the field. Myself and other humanitarian workers are traveling to Colombia to ensure that we are strengthening the coordination, because definitely we are in a long-term response and we need to think in a medium and long-term response. So, for instance, we need to let the search and rescue teams following the work right now, because there is a lot of the rescue response in place, and our priorities is shift to establishing safe spaces for the women and girls inside the improvised shelter right now, how we can provide the support for the protection protocols in place, and advocate at the UN level and civil society to expand beyond the current households authorizations to enable cash-based assistance will be important to respond with speed and dignity. So CARE, as other NGOs, are present in the field because the support is massive, and we right now not receiving all the current information because electricity is also a gap. So we don't have all the gap assessed, for instance, and we need a medium and long-term commitment to this response.
Catalina Vargas Villamarin, thank you very much for your time this morning.
Thank you so much. And thank you for this space to commit our response from CARE International.
All right, we're going to